The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. Any choices you make in determining your child's treatment are completely at your own discretion.
Good morning and welcome to Autism Live. I'm Shannon Penrod. We're coming to you live from our studios in Woodland Hills, California. We are live right now on Facebook, YouTube, Twitter, and about a dozen other sites. It is the 1st of March, 2023. It goes so fast. I'm really excited about today's show and really hoping, we've already got, Michelle is watching and we love that. We've already got some people watching because we're going to be talking about feeding issues with a really great expert, Dr. Yev. I'm not going to slaughter her name because there is the capability to slaughter her name, so I'm not going to do that. But Dr. Yev is going to be joining us in just a few minutes. She's amazing. I had the opportunity to meet her in October of last year when I was up in Seattle, the lovely city of Seattle, for a speaking engagement for WABA, and met so many amazing people, but really Dr. Yev was a standout amongst those people. We'll talk more about that in a minute. And sorry that it's taken us so long to get her on the show, but she's busy and we have been busy, but it's here, it's today. And she's going to talk with us specifically about feeding issues and what she's been working on for families. I think you guys are going to be really, really excited. So if you have a specific feeding question, you can go ahead and write it in now and we'll share that with her when she joins us. And I know that there was a very specific feeding question that was asked yesterday, and of course I didn't bring it in with me. So if you're there and watching, ask the question again, because I sort of remember it and I don't want to get it wrong. Okay, but before we do all of that, I want to remind you of a couple of things. We're live right now on Facebook, YouTube, Twitter, a bunch of other sites. Traven's going to show those to you in just a second. And but interaction is available right now if you're watching us live. Now, many of you don't watch us live because your life is busy and you have other things to do at this particular hour. Well, we've got you in two different ways here. First of all, actually, we've got you in a bunch of different ways, but you can go to our YouTube channel and watch any of the videos that we've done in the past 12 years. They're there. You can search topics and see what, good morning, Susie V. And so all of that's there on the YouTube channel, but we also podcast the shows. So, and now we podcast this show audio only, so you can get us in all the places that Traven is about to show you, including iHeartRadio, Apple Podcasts, everything that there is. And we hope that you will check us out in whatever forum works for you. Now, if you want to be able to write back to the show or suggest topics or ask a question, there are a couple of different ways that you can do that. You can write in on the Autism-Live site. It's not perfect. You can go there and you can ask a question there on the comment, the chat. It's sort of misleading because it leads you to believe, oh, I'm going to ask the question and somebody's going to answer it back here. We don't have the capability of doing that. That's not really what it shouldn't say chat. It should say question, right? But it doesn't. We're going to get that changed. We are. So anyway, feel free to write in there. I think the quicker way, the more efficient method is to email me directly. And that is, my email is shannon@autism-live.com. You can write directly to me, and if you're referencing an expert that was on the show, just do me the favor of telling me as much as you can remember about the expert, whether it's, you know, I saw them on the show 2 years ago and they were talking about this and, you know, it was a lady with white hair. You know, that helps me narrow it down. You'd be surprised. Especially if you tell me this is what they were talking about and this is my question. Because then what I do is I go back to them and say, this question came in about something that you were saying, right? Otherwise, it's a general question. It comes to me and I will go to Dr. Grampiche to answer questions that I don't know. And sometimes I might have a resource for you of a place for you to go and ask them. So we try to do the best that we can. And all of that is a free service to you guys. Good morning, Christina. Thrilled to see you there. So those are the ways that you can be interacting. But I also want to say that we have coming up on April 4th, we are launching the first ever Autism Network Podcastathon. And this is when we are going to go live for 44 straight hours, nonstop, the whole time. It's a little crazy, and I am terrified. I'm just admitting that, but I'm getting less terrified because we're certainly not doing it by ourselves. And we have so many people who are going to be participating with us. Any top podcast about autism, it's going to be here during that 44 hours, doing their own shows for you. We are also going to have several hours of Ask Dr. Doreen and several hours of Autism Live. I can tell you that Dr. Temple Grandin has already agreed to be live with us on the first night. Where that calendar supposedly is going to be available soon for you guys. We're just having a problem with an app. Like who isn't having a problem with an app, right? Oi! But then you'll be able to see and sort of chart when you want to watch. And the thing there's so many things that I love about it, right? First of all, I love that the autism community is coming together to bring you guys free information and inspiration. This makes me very excited, and we're just going to be hosting it. So that's super fun for me. And we're going to get to do some of our stuff that we do with you guys regularly, but we're going to give you tastes of other people, sometimes in other countries, and other ways of looking at the situation that you might be dealing with. It's all going to be interactive, so I love that, right? We also, can I tell you, Joe Mantegna also agreed to be a part of it day before yesterday because he's a mensch. He's the menchiest of menches. He's always so willing. What an amazing guy. So, and we have other celebrities that we have asks out to that we're hoping that they're going to be with us as well. There is a rumor going around that in the final hour that Dr. Grant Pichet is going to shave my head. I would like to say that there's a distinct possibility that that will happen. I can't do it in the earlier hours because, when they shave, or cut your hair, I have that sensory sensitivity that I will need to immediately take a shower. So if it's going to happen, it's only going to happen in the last hour. And we're going to be, at the different times that we're doing Autism Live and Ask Dr. Doreen, we're going to be asking for donations for iPads through Act Today that will, there'll be grants. We're raising money for grants specifically for iPads because I would love to shave my head and know that that meant that there were going to be iPads in young people's hands. So lots of stuff. We're also hoping to have some great giveaways during the 44 hours, but great information, great inspiration. Yes, I'm excited too, Christina. I'm verklempt. I'm so excited about it. And also, so many of you said around the world, gosh, we really love your show. We'd love to feel what it would be like to watch live. So there will be plenty of opportunities. I can tell you that on the first day, so the first day, which is the Tuesday, we will do Ask Dr. Doreen in the morning as we always do. And then at 3 o'clock that afternoon on the 4th of April, we will do our kickoff hour. I think that's the hour that Joe Mantegna is going to be here. We've asked some other people too. And then we will go into 2 hours of just Ask Dr. Doreen, answering questions. Although I think one of those shows she's going to focus specifically on anxiety. Then we have an hour that's, the guests, I can't even tell you yet, but it's pretty exciting. And the hour after that will be Dr. Temple Grandin. Then the rest of the hours that Autism Live is in will be middle of the night hours, so that people in Australia and Dubai and Pakistan, all the people who have said, hey, we never get to watch you live, there will be some live hours in the middle of the night. And one of those hours, I did a one-woman show called the Autism Monologues that was a comedy show, and we never were able to show you some of the things from that because there's some pre-recorded elements of it. But one of the hours, we are going to be showing some of the pre-recorded elements of the Autism Monologues, and the director of the show will be here with me talking about that. Philip, good morning. Thrilled that you're here. So today we are going to be talking about feeding issues, and I do want to say, first of all, that we have lots of experts that are going to be with us during that 44 hours. We have lots of experts that are on the show on a regular basis. I do have to give the disclaimer that I am not an expert in the field of autism. I am a pony A very proud pony. I love that. I always feel like I should have a ponytail when I say that. I'm a pony, and whip my ponytail around. I don't have one of those, but maybe I can get a wig. So I'm a proud pony, which is a parent of a neurodiverse individual. Those are the words that I use now. Over the years, I've used lots of different words to describe who I am in relation to autism, but these are the words that I use now. I know sometimes people watch videos that we did 12 years ago and take issue with how I identified myself back then. That was 12 years ago. I'm not going to apologize for the words that we used at that time because that's how we identified. But now those are the words that my son asks me to use, and so those are the words that I will use. And if that offends anybody, I'm terribly, terribly sorry, but I have to be true to my son and to myself. So there we go. And I am a proud parent of a neurodiverse individual. And he was diagnosed with classic autism at the age of 2.5, and he is the light of my life, and about to be 20. I can't even handle that, but I'm so proud of him. So I'm not an expert in autism. That's how we got here to this part of the discussion. But I am a person who wants to be an ally and wants to be an accomplice. Now, I'm using that term because Amy Gravino, I heard her speak last week, and she was like, we need allies, but we need accomplices more. So I'd like to be an accomplice and help individuals who are on the spectrum to get all the civil rights that they deserve, social civil rights, everything, jobs, right to love who you love, right to wear what you want to wear, shake hands or not shake hands, make eye contact or not eye contact, because everybody should be allowed to do what they want to do. If it's, look, here's my litmus test. If it's not hurting anybody else, get over it, right? You know, if your choice to not shake hands, who is that hurting? Please, can everybody grab a whoopee? That's all I'm saying, right? Okay, so in any case, that's who I am. Don't confuse me with the experts, but do confuse me with somebody who cares deeply about whatever it is that you are facing right now. This is not a one-size-fits-all community. And by the way, this show, we seek to embrace the entire community. Of course, that starts with individuals who are themselves on the autism spectrum. That's an of course, right? Their needs, their wants, what they want to say, what they need us to hear, right? So of course that, but then we welcome everyone who loves those individuals, everyone who is trying to support those individuals. That might be a parent, it might be a caregiver, it could be a grandparent, it could be a teacher, it could be a BCBA. Anyone who wants to support those individuals to live their best lives, that's who this show is for. And we take that pretty seriously. And we have all kinds of programming now on the Autism Network to fit different needs that you will see. For instance, Stories from the Spectrum on Fridays is solely the voices of those on the spectrum and no other voices, which I'm very, very proud to be on a network where that is a priority. Okay, so we want to start with Jargon of the Day so we can get to Dr. Yev, and because we're talking about feeding issues today, we decided to go with the big feeding issue jargon that there is, which is often very misleading. So let's take a look. First, we're going to give you the actual definition, then we're going to give you a working definition and try to give you a context for this. Because I think the first time I ever heard Pica, sometimes these terms are misleading, and I heard Pica, and I didn't know if it was a dress designer, a shoe label. I didn't know if we were talking about pixels, like what the heck did it mean, right? Was it a type of food? I had no idea. This word doesn't give up much. Just taking a sip of water. So let's take a look at, but this is not something to be made light of. This is a very, very serious term. And if somebody is talking to you about this in your life, whether it's you or the person that you love, it's time to take it very seriously. So we're not going to make too much fun of this definition. But let's take a look at what our actual definition of Pica is. Intentional and compulsive consumption of non-food items. Ooh. So it's not by accident that you went to eat something and put something in your mouth by accident, and it is considered a compulsion, and it's non-food items. Now this can range, quite far, right? We know kids that will eat dirt. We know kids that will eat their own poo. And so this becomes a big, but kids will eat hair. We know kids that have eaten batteries. This gets very serious because this literally can be life-threatening very quickly. So let's take a look, not making fun here, but let's take a look at because normally we make fun of the actual definition. But now for our working definition, it's eating things that are not meant to be eaten. And I think sometimes that definition helps parents to get a little clearer about it, because I think when you have a girl and she sticks her ponytail in her mouth and she sucks on it, but ends up eating a little bit of hair every day, I think that a lot of parents go, well, that's just a thing and it's not that big of a deal. It actually is a very big deal, because we don't want Pica to get any worse than it is at any given moment. In fact, this is one of those things where there's a lot of things that we go, well, they want to hand flap. Well, when they have time to hand flap, let them hand flap, right? Pica is not one of those things, because it can easily transfer from one thing to another, and it can be, as I said, life-threatening. Even having hair, because your body can't digest hair. And there have been a couple of times with not necessarily people on the autism spectrum, because not other people engage in Pica, right? It's not just something that happens with individuals who are on the autism spectrum. But we've seen cases where young women have had to have surgery when they're like 16, 17, 18 to have a hairball removed from their stomach. And that's a big surgery. It's not a surgery that anybody wants to do, but it's restricting their ability to take in nutrients. But we've seen other kids ingest, like I said, things like batteries, and should the batteries come open, that's acid. And that is no bueno. Okay, and we've got somebody already writing in about needing some behavioral help for poop eating, also feeding therapy and dietary supplements. This is where it all gets, real serious, because our kids, some of them will engage in Pica with the poo. And I think it's so devastating for parents, because it becomes, like, there's some things that our kids eat that we go, oh, okay, that's a problem, and it just is the problem, and how do we address the problem? But I feel like with the poop, it becomes a thing of, oh, and it's shameful too, and people are going to be disgusted by it, and people aren't going to be around my child. People, his grandmother isn't going to want to kiss him, so on and so forth, right? There's stigma attached to the eating the poop, so it's extra. There is help for Pica, but it's very individualized, and you need professional help. I say, in all honesty, parents should not be taking on Pica, but really most feeding disorders completely by themselves. What I love is that Dr. Yev is going to be talking about how she supports parents, which is a really remarkable thing, and not something you see a lot of in this field. We had to buy a big kid onesie to help with the poo digging. And, when there's poo digging, sometimes there's poo digging and then it ends up on a finger, and then there's just a curiosity. And you guys, I'm sorry for this discussion, but, if it's TMI, but, these things happen. But if it's poo digging, then I know this particular person that you've been working with, a gastroenterologist, because sometimes there is, if there's IBS and other things that are going on, I'm not a gastroenterologist, but then there's the uncomfortableness of that there's things left, around the anus, and so they dig because it feels uncomfortable or it itches, right? So you want to make sure that you are talking with the gastro about digging, first of all. And we have an appointment with a psychologist and nutritionist soon. I'm glad. Yes, my son, and now he has grown out of it, or in the probiotics house, and he takes himself to the toilet now when he has to poop. Wonderful for that parent, and she says, we went through that, and I'm so thankful that it's over. Yes, and I'm thankful that you're being an example of a parent that, yes, you can get through it. I don't know how much I don't embrace the grow out of it kind of thing. And I don't want anybody to get the idea that, we'll just wait and see if they grow out of it, because too often what we see with Pica is that once it starts, if we don't get control over it, it can lead to other things. So we don't want to do that. So this is serious business, and it's time to, and I see that the other mom, that you've got appointments, and that's good. I would use this word to say that this is what's going on to get their attention. They may ask you specifically, then talk, and if you can, take data on what is happening. We've done it before, that 3-sheet, ABC, you know what I'm talking about, Christina, I know you know. Take some data on it before you go and meet with those people, and you'll get more out of that appointment, is what I'm going to say. So let's talk about our guest, and she's got a lot of things that she's going to talk. I didn't specifically ask her to talk about Pica, but if it comes up, it comes up. So I am referring to her as Dr. Yev, because that's how I heard her students refer to her, and I'm going to go for it and slaughter her name. Dr. Yev Veverka, sorry, she's going to say it for us, is the Interim Director of Applied Behavior Analysis Program at the University of Washington, and a Board Certified Behavior Analyst doctoral. So she's a BCBA-D. She's Dr. Yev. Her research and practice interests include autism spectrum disorders, parent and caregiver coaching, we love that, and mealtime support and intervention, which is why she's here. With the Herring Center's FEAST program, and FEAST stands for, get this, feeding, eating, and supporting together. Don't we love that? Dr. Yev has developed a tiered approach to mealtime support for early learning settings. How much do we love that? The FEAST team has been manualizing, researching, and disseminating their approach to this use in early learning settings across the nation. Dr. Yev is passionate about helping family mealtimes feel fun and successful through caregiver coaching and education. She is also a parent herself, 3 children, one of whom was on the spectrum, which I know from talking to her has really fed the direction that her career has gone, and that her experiences have led her to her interest in the reform of applied behavior analysis. Yes, I said the reform. I know many of you will be excited to hear that. She is the co-founder and co-organizer of the Coalition for the Reform of Applied Behavior Analysis. It's a group dedicated to the continuous improvement of the application of ABA to improve the quality of life for its consumers. I think we can all be excited about that. So, Dr. Yev, are you there?
I am here.
All right. How badly did I slaughter your last name? And say it for us so that it's not.
Great, actually.
What is your last name?
Veverka.
Veverka. Oh, it sounds so much better that way. That sounds exciting. Okay, so good to see you again. The last time I saw you, you were charged with having to drive me all over the state of Washington, but I was thoroughly enjoying it. So I appreciate
It was fantastic. Me too.
I appreciate your time. So let's get started with, how did you become interested specifically in your work around mealtime?
Yeah, so I think most people can relate to this that work in the field of autism, but as early as I remember, I would work with families from when I was a behavioral therapist and through my time as into becoming a BCBA. I'd work with families and their primary goals were always around these like routines. And one of them was mealtime. So they'd say, help me help my child eat healthy foods, or eat more variety, or eat something other than crackers. And I remember distinctly like doing trips to Burger King on a regular basis to get the same, hamburger patty, plain, no ketchup, with the side of fries, and anything that was different about it wouldn't be eaten. Families would often tell me that their healthcare providers weren't concerned about the growth, and so they would like kind of just brush it off as typical. And then families would come to me and say, but then why am I crying over it? Why am I so upset over it? Why can't I feed my child? And I realized that there's a lot of pressure around children as a caregiver. So just the influences all around parents and caregivers around feeding are pretty strong, that we have to, and I feel this as a parent now too, you have to make sure they eat their servings of vegetables and get their protein and have a variety. And it's just one of the most cited concerns of families with young children, but then especially so in children with autism. So it became something that I was really interested in supporting in the home. So supporting before it became a problem that was clinical and needed to be referred to like an intensive feeding clinic, for example.
Yeah, and you mentioned some of the different things, that sameness that, kids, I know a kiddo that it was the Burger King French fries. He could only have those, but they had to be a certain temperature. So if mom had driven to Burger King and it took her more than 15 minutes to get the French fries to him, then he would not eat them, and it was a waste of money because they weren't hot enough. But if she would hand them directly to him, he couldn't eat them then either. I mean, this woman was working overtime and she was fearful that her child, was going to waste away because that's all that he would eat. So there are all these, and we've got somebody writing in and saying that food textures are a problem, that they won't eat smooth foods. We've got a 10-year-old that they still have to feed them, that because he will pick up everything with his fingers. What other kinds of challenges? These are some of the very common ones. What other kinds of challenges do you guys see, just so that everybody can go, okay, I'm not alone in this?
Are you asking me? Sorry.
Yes, I'm asking you. Are you able to hear me?
Okay. Yeah. Sorry.
Okay.
So specifically in autism, it makes sense that we're seeing a lot of these challenges because they coincide with those characteristics with an autism spectrum disorder. So mealtime is, in most cases, a series of social interactions. So if a child is already having some social interaction differences, the whole process can be a little challenging. There's also communication challenges. So we see challenges in communicating their needs and wants around food. So that's really frustrating for children to not be able to say, it's this thing about the food that's aversive. I don't like how it feels in my throat, or I don't like the smell or how it looks. So there's communication difficulties. There's this focus on detail. So I always remember this little boy I worked with who he had this one oatmeal that he consistently ate, and his mom was so happy because she knew that every morning he would at least eat this oatmeal. And one day she got this new pack out and she put it out and she said, here's your oatmeal. And he just lost it because he kept saying something about a number 6 was missing. And sure enough, we dug out an old container and there was like this little number 6 somewhere, we don't even know what it means, on the package, and it was not there on the new one. And so he refused that oatmeal. So like that kind of need for sameness, need for routine. If I'm not sitting at my exact spot with the, like you said, the exact temperature of food with the fork that I'm used to eating, then I can't eat. And then we see a lot of like sensory aversions or sensory aspects that really matter, which makes sense because everything about mealtime is sensory, right? So there's, the temperature, the taste, the texture, the feel of it on your fingers. And that kind of goes along with what you were talking about earlier, Shannon, with eating things that aren't edible. And another common concern that's kind of cited with this, in addition to refusal to eat or be selective about eating, or just like your typical picky eating, is refusal to take medicine. So most children with mealtime challenges also have, their parents also report challenges around medication, which, as we all know as parents, is really stressful.
Yeah. And then they're also bringing up issues like oral motor issues. Like I know parents who say my child can't, won't chew crunchy stuff or won't swallow things that don't have a crunch to them. And as somebody is saying, he has issues with moving things around with his tongue. I'm not sure, Christina, whether you mean that he does it excessively or doesn't do it enough, because we have both things that could be happening, right? Then food selectivity, Alyssa says food selectivity, that there's only 10 items that they will eat. And Alyssa, I will tell you, I've heard of kids who will only eat 2 things. So, you've got concern about the 10 things, but it could, it can be, oh, I see Christina. She says he's not moving things around enough with his tongue. Well, I want to go to the next question, Dr. Yev, which is at what point should parents say, okay, this is concerning, this isn't just your typical picky eating. At what point does it become something that you need to seek help and target it?
Yeah. First of all, can I just check in? I saw somebody commented that my mic is too hot. Can you hear me okay?
Yes, I think it was a little too loud, but Traven, are we good now? I'm looking for a thumbs up over there. It was, for a minute, it was like it was going back and forth. Okay, but we're good.
Yeah, I heard a little bit of an echo. Okay.
So I think we're good now, but thank you for noting that, and, but yes, I think we've got you at a good level right now.
Okay, yeah, so this question of at what point should families be concerned is kind of my soapbox issue. And Shannon, you actually just commented on this too. You commented, I don't embrace the grow out of it. And so while healthcare providers might kind of look at the growth chart as the primary indicator of if this is a concern or not, there's so much more to it. And there's no purpose in waiting for those negative health implications. So it's okay to be concerned if you feel stress, if your child is showing signs of distress around mealtime. If mealtime's not enjoyable as it should be, you can do something about it or feel concerned. If your child's missing out of like events and celebrations, I often talk to families who say birthday parties are a nightmare. They don't want to be near the cake because they can't look at the frosting, and so they can't participate. So if they're missing out of social events, even if they're growing fine, you can be concerned. If you're having to prepare multiple meals and you don't want to be, you can be concerned. So the point here is caregivers have reported frustration about the dismissal of their concerns around mealtime and feeding. And if something's concerning to you, it's valid.
Yes.
Oh, sorry.
Yes, no, I just want to say, I totally agree with you. I think so often we're told that, oh, the house has to be on fire in order for you to be concerned about it. And that doesn't jive with our gut. Our gut says, food is love. And it's a way that you communicate with your child, and it costs money, and you put food in front of your child and you want it to be a happy interaction, and you want to nourish your child's soul and their body. And when we have kids that are gagging and throwing up, or just refusing, or there's a battle, I think that one of the many things that I love about you, Dr. Yev, is that you're coming at it from a point of view as a parent yourself, and saying this shouldn't be a battle, and that it doesn't have to be like Pica. For sure, you have to at that point be bringing in an expert, but if you're just having difficulty because you're having to cook 2 separate meals for every meal, you can be talking about it, and your concerns shouldn't be dismissed by the experts that you're talking to. So yay, Dr. Yev. Okay, so what are some things, let's go into some practical things here about how families can make that mealtime more successful.
Yeah. So I kind of think about this in 2 categories. One is just like setting yourself up for success, and the other is those support strategies that you can do when interacting with food. So there's just kind of this baseline you want to establish. And a couple components that I think about with that are building trust with your child, and then just creating an opportunity for repeated positive interactions. So if mealtime is a battle right now, you're not going to jump in and say like, okay, let's try a carrot. You want to first build that trust that mealtime isn't going to be a battle, and increase your positive interactions to make mealtime fun before you start introducing new foods. And that's a common mistake, is people just start to do this like repeated exposure. Let's try this, and then let's try another food. And they don't have that baseline where their child trusts them first. And I've struggled with this myself as a parent as well. So as far as building trust, we want children to trust that mealtime will be enjoyable. This next one's a big one. We want children to trust that they won't be tricked. So I am guilty of this too, where I've tried to, like put things into the favorite muffin, bake in the carrots, bake in the zucchini. I've seen this backfire so many times, where children's, one of their few limited foods that they will eat, like the muffin, is messed with. And then they lose that trust. They lose trust that when my parent puts out my favorite muffin, it's going to taste the way I know it's going to taste.
Okay,
So
in the beginning with the favorite foods, don't mess with it. Because
don't mess with the favorite foods.
I've had big success with sneaking foods into things, but I have to say that I did it much later along the way and not with the first favorite food. So in the beginning, don't mess with the food and set this up as a time that they can trust you. Okay.
Yes, and all of this, that's a really good clarification. All of this is the beginning. So if you're coming into this and watching this and your meal times are a battle, we're not going to start by being sneaky. We're going to start by taking multiple steps back and building that trust that you won't mess with their favorite foods, trust that their favorite foods will be available for them, and then trust that they'll be allowed to listen to their body. So again, this is another thing that comes with the pressure as a caregiver to feed our kids so they grow and so they're healthy, whatever that means to us. And so sometimes we say things like, okay, 5 more bites and then your dessert. But if your child is full and you're telling them, you're dictating, you need 5 more bites to be healthy, that doesn't promote that trust that they will learn how to listen to their body. Again, another tricky one, another one that's like they might need some encouragement and help along the way to understand those feelings of being full or being hungry. And a lot of us still need help trying to figure that out, right?
We have a famous story in my family when I was an aunt before I was a parent. And one of my nephews, Brian, and he's never going to see this, and he knows I tell this story all the time. I would take care of Brian one afternoon a week when my brother and his wife were working. And I picked him up at daycare, and I would take him to the store and let him pick out what he wanted to have for dinner. And he picked out a can of the SpaghettiOs that were gargoyle shaped. Nothing would do. He wanted the gargoyle-shaped SpaghettiOs. And so I bought them for him. I went home. I prepared it. I fixed it for him and thought he's going to be ecstatic. He ate a couple of bites of it, and he was like, no, I don't want any more. And I'm like an aunt, and I'm the fun aunt. It's gargoyle pasta. You asked for it. And I was like, you have to eat 5 more bites at least. And he was like, no, 3. And he was like, no. And I said, yep, 5 more bites before you can get down. And he ate 5 more bites, and then he threw up the whole thing all over the table. And I went, oh, no. Maybe I could have listened to the child who was telling me I'm not able to eat any more of it. It was quite, and I had to clean it all up, and it was quite the lesson to me of, okay, because I don't want anybody standing over me telling me, when I'm full, 5 more bites. So that helped me when I got to parent my own kid. It's like, oh, maybe we're done.
That's such a great example.
Yeah. Several more comments here. Somebody says, my kid smells everything, determine if he's going to put it in his mouth or not. So in this stage, you would let them, correct? You'd be like, let them smell
absolutely.
it. Absolutely. Okay. So in the beginning here, I can hear people going, what? I get to just end the battle? I'm going to give them what it is that they want. How long would this phase last, Dr. Yev?
So it's hard to put a time on it. And I know it's frustrating and it's hard to be patient when you're still kind of in these beginning stages. But I think a question you can ask yourself is, what does mealtime mean for my child right now? And if it means, oh shoot, I have to put away my favorite toy and I'm gonna get forced to eat, and then I'm gonna start the bedtime routine, and it's just all these demands are gonna come out and my night is over, then it might take a lot longer to kind of build this, you want them running over to the mealtime. When you say it's time, you want them excited, you want them coming over ready to sit down or wherever you have your meal. And that behavior is your hint that now you can add some additional demands or start interacting with foods in other ways. But step 1 is just mealtime has to equal fun for them. And not the end of their favorite things and the beginning of all the demands and aversive foods.
And a lot of different ways to do this, like preparing the foods that you already know that they like, but also, I'm sure that you guys have come up with so many creative ways to make dinner fun, whether it's the placemat that the food is on or the plate that the food is on, or, I would imagine you have the favorite beverage And then also making the sitting around, because sometimes just the sitting at the table is the hard part. So if they want to eat on the floor, you sit and eat on the floor, whatever it is, so that we're establishing that mealtime is a fun thing. And we establish that before we add anything more. Have I got it right?
You've got it right. Yeah.
Okay.
And it could be simple things like we play a favorite song, a silly song when we all come to the table, or you're putting away that food that makes them gag, you're putting it behind a barrier for now. So it's not even a thing on the table. Or you play a little family game, or you turn down bright lights. Like it can be really simple things. You don't have to, today at dinner, if you're thinking like, oh my gosh, I have to redo my entire mealtime, that's not the case. You can add a little fun component. Or if you're a family where you're having to feed your child and then eat separately because of your mealtime concerns and challenges, then maybe it's just having them play their favorite game or watch their favorite show at the table instead of in the other room, or wherever you're eating, having them there with you doing a favorite thing, establishing mealtime as fun, even though mealtime for them at this point doesn't mean eating with the family. So
now, some of this, taking away the battle of it, is going to make some of you go, no, but we have rules and we have customs and my mother-in-law won't. But I think at this point you're saying shove all of that in the nearest coat closet and we'll come back to it later, right?
Yes, it takes patience and it's hard. And I always tell families it's not going to be forever. But if you want to establish, if you want to remove that battle and kind of flip the way mealtime feels for you and your child, you have to start by pairing it with those fun things first.
Okay, Rosemary loves the idea of playing the favorite song right before mealtime. And Joannie has said that her 10-year-old with ASD doesn't know when he's full or hungry. How do we teach that? He will ask for a snack and I offer something healthy and he says, no, thank you. I think that's an indication that he wanted to eat the thing, but he wasn't hungry. Am I wrong?
Exactly.
Okay. Because when they are hungry, I had the kid, because of other things, I had the kid that would eat vegetables, and we would be in a restaurant and people would go, I've never seen a baby eat vegetables before. How are you getting that baby to eat vegetables? And I would always say, because he's hungry and that's what we put in front of him. Now that doesn't work for all kids, right? Because if they have a sensitivity to things or whatever, but he had that from the time that he was a baby because I was a vegetarian. So vegetables were what we had and was available, and he was hungry. We hadn't let him snack beforehand, so he would eat the vegetables. And I have seen kids eat things that the parent says they will not eat, but we took away the sugar snack that they would normally have at 4 o'clock so that when it was dinner time, they were actually hungry. I don't want to take you off of your thing. But I think, Joannie, if you offer him something that's healthy and he says no, eventually he's going to be hungry enough to want that. Or am I completely wrong, Dr. Yev?
I mean, I know this is an annoying answer, but it kind of depends on the kid. In some cases, that's completely right. In other cases, that it's kind of a myth that kids eat when they're hungry. It's like kids eat when they're hungry and the correct circumstances surround them. And so like I think about myself too, like even if I'm hungry, if something's put in front of me that gives me a gag reaction, I'm not going to eat.
That's
or
true.
If something's put in front of me, or like if I pack my lunch, and you all have probably done this, if you pack your lunch with you but it's your like leftovers that you've been eating multiple days in a row and you're hungry and you take it out and you're like, oh, I'll just take a few bites, but I'm not really that excited about it. And then your hunger, like the motivation to eat can change depending on the context around you.
A good point, good point. Okay, so once we get to the point where we feel that we've got that baseline of dinner is now no longer a battle, your child trusts you, and that for some people that might take a week, and for other people that might take a while, right? Like maybe even 2 months. That it could take to establish that baseline. But once you've established the baseline, what's the next thing on your tier?
So there's a few things you can do, but one thing, I learned this from an occupational therapist years ago, and she called it the parentheses diet, and I love starting here. So you kind of think about, okay, what is something my child will eat? And I'll give you an example, cereal bars. And then you say, well, what goes in the parentheses? So they'll eat cereal bars, but they have to be Nutri-Grain brand. They have to be whole. They can only be strawberry flavored, and they can't be unwrapped for them. And so when there's that many things in the parentheses, you're not going to be able to just say, like, let's try introducing bananas. You have to work out those things out of the parentheses first. So a possible first step in that case might be just reinforcing tolerance of it being unwrapped a tiny bit. If it can't be unwrapped for them, then they're not going to tolerate change that's really big in the form of a new food. But you can work on, okay, how can I reinforce? Like, what are some fun things we can do when they are okay with me unwrapping it? And again, this isn't tricking it. We're saying, like, okay, we're going to do this. It might be tricky, where this is something new. After we do this, why don't we play our favorite song? Or let's play that favorite game we have together, or bring the toy to the table. So really reinforcing flexibility with change first, rather than bringing in a new quantity of something, would be most of the time my starting point, those baby steps.
Okay. And Christina has said, my son eats a bite and runs and goes to a sensory activity and then comes back. So in the baseline phase, we would say that this is okay, correct?
If mealtime is enjoyable, that's a good start.
Okay. But eventually, if we want to work towards him being able to sit in a chair and eat without having to get up and run to a sensory activity and come back, so let's say he's eating the applesauce, but the parentheses is that he's only eating it if he can take a bite and then go run and do something sensory. So how would you work on that?
Yeah, so the baby steps for that, there's a couple things that come to mind. One is the kind of the most fun thing to do would be to somehow make the eating a sensory activity, but it depends on kind of what he's seeking. But is there a sensory activity you can bring to the table to increase the amount of time he's there? So then he, takes the bite of applesauce, plays with the sensory activity right next to him. Or can you increase and say, like, okay, two bites, first 2 bites, and then let's go together and make it a fun game. Like, instead of saying, like, stay at the table, you're joining him in that, but you're increasing kind of the request, or how, maybe not the 2 bites, but how much time he's sitting at the table. So we, again, are teaching him to listen to his own body too.
Love that. So when people are in the part where they're working on the parentheses, I'm going to guess that they really could use some support for that phase. That for the parent, it's a little overwhelming. And so talk to me a little bit about, you've got this wonderful feast program. How would somebody either reach out to you, or can the people that they're working with get trained in the feast method? Like, talk to us a little bit about how that would work.
Yeah, absolutely. Through the University of Washington's Herring Center, we're working on some trainings and are available for those. So Shannon, I'm happy for my email to be shared for folks to reach out, because we can kind of tailor it depending on what the need is. We'll have some like self-paced mealtime training online available pretty soon here. But yeah, we can certainly work to support folks in whatever that means for them.
Okay, so I would definitely reach out to Dr. Yev. You guys, do you want to say what your email is for those that are listening in podcast?
Sure. Yeah, it's yevev@uw.edu.
It's not as hard as we thought it was going to be. We have to, and we'll try to put that in the notes, the show notes as well. So you can reach out to Dr. Yev and talk about that. And you can also reach out to your provider for whatever services that you guys are getting. I think feeding comes under a very interesting heading sometimes, Dr. Yev, that I have heard of ABA providers certainly that have done feeding training with caregivers, but I have heard of ABA providers who have said, we don't do feeding issues, which is interesting to me. I have heard,
It is interesting.
right? Isn't that interesting? I have heard of OTs who have worked on certainly the oral motor kinds of things, as well as SLPs, sometimes in some circumstances. But far more often, the parent goes, I have a team of people and no one does feeding issues.
This is kind of what inspired our tiered approach to feeding, is that it doesn't all have to be like we wait until somebody has a clinical diagnosis and they have to be referred for intensive feeding services. We can do things before that proactively. We can make eating fun. And so that's kind of what we call the bottom tier of feeding intervention. So it's that, like, what can we do to embed into home meal times to make them enjoyable? And so it's not, don't even refer to myself necessarily as a feeding therapist or feeding specialist, but a BCBA who's interested in making meal times more enjoyable.
Well, and that is an amazing thing to be interested in doing. And we said at the beginning that picky eating is just one of the many concerns, that there's a whole lot of things that people have to deal with. What are some simple strategies that parents can implement maybe even today, whether it's picky eating or something else? We've been talking about that, but what else do you have in your bag of tricks you can share today?
I think this is kind of more picky eating related, but one thing that I would hope people would leave here with is to redefine what it means to try it. So Shannon, maybe you can help me pick kind of what a do you have a non-favorite food that just like you can't even think about without having a reaction?
Well, I love all vegetables except for wax beans. I don't know what the purpose of wax beans is in the world. They squeak when you eat them. They're not flavorful. They taste like cardboard. I don't want wax beans. But I will eat them if forced. If you want something that really makes me gag, then we're talking about calamari.
Calamari. Okay, let's go with calamari. Ooh, I love calamari.
Ah.
So this is actually a perfect example. So you come back to Seattle, Shannon, and we go out to a restaurant and you're hungry because we've been walking around and touring and it's been smelling so good because we're at the Pike Market, right?
Yes.
And everything smells good. Your motivation to eat is high. We sit down and I order my favorite food, calamari, and it comes out, and what happens to your hunger? It completely disappears, right? You're like, wait, no, thank you. My stomach no longer is giving me those cues that I want to eat. And if I am like I am sometimes with my kids, even though I know better, I might say, oh, come on, Shannon, this is so good. It's one of my favorites. What's the big deal? Just try it, just a bite. That try it doesn't really make you want to try it. You still are having that gag reflex. You're still like, you're shut down, your motivation.
I would go shopping while you ate.
Gone.
I would go shopping.
Exactly.
I would be like, I'm going to go look out the booths. You enjoy your meal, Dr. Yev. I'll catch you when you're done. Which is the kid who gets up and leaves the table, right?
Which, yeah, exactly. Yeah. So even though I'm saying it's just calamari, like when you say that to a child, it's just a banana, it's just yogurt, and they're like, I can't even look at it without feeling something. And like, if everybody watching this thinks about that food that makes them like have that visible reaction, like your face changes, right? So redefining try it is the thing that I would encourage everyone to do today. So try it can mean just look at it and stay with me, and let's order you something else and you be okay with me eating it first. So that could be an exposure. And this repeated exposure really works. So exposure doesn't have to be put it in your mouth, like chew, swallow, eat an entire serving size. It can just mean be tolerant of it today. And then maybe down the road, you get used to it being offered and you might touch it, you might smell it, you might dip it into like your favorite sauce of all time and kind of like lick the sauce out of it, get a little bit of taste out of it, but it's going to be a long time before you're willing, if ever, to actually take a bite of it. And so just redefining that and kind of following your child's lead to put more of their favorite foods or like combine foods in a way that might be more fun or more enjoyable is, I think, the one kind of easy thing to start with.
And I love that all of these things don't require the parents to rearrange their entire lives. Because a lot of times, the advice that people give us, it's like, oh, I have to do everything different, which I feel like as a parent makes me go, oh, so it's all my fault, right? So I love this because this is a kinder, gentler way of dealing with today and saying, you know, we're going to get there, but we're going to get there on the slow-moving train. And we've seen, research shows that exposure thing does work. I could see where if there was like 32 times that you sat and ate calamari in front of me and then eventually said, you know, do you just want to smell it? I could see where it might take me 2 years, but I probably could eat a piece of calamari. I don't want to push it, but maybe.
I kind of want to work on this now. Next time you visit.
Yeah, I'm total vegan now, so it's not going to happen. But
Okay.
But you know, let's face it. If there was a motivation for me to do it, like I needed that to stay healthy or whatever, or you made like, you know, if I was on a game show and they offered me $50,000, I would be choking the calamari down. I would. I would be very unhappy about it, but I would. Okay, they're asking a bunch of different questions, but they would like your email address repeated again, please. And Traven, maybe
Sure,
if you can put it up, it would be great. Yeah, go ahead.
yev@uw.edu.
And there, Traven's got it up there on the screen for you guys. And we will put it in the show notes as well. Joannie wants to know, Dr. Yev, do you recommend dipping sauces?
I love using dipping sauces. So, I mean, I could talk about mealtime for hours, but dipping sauce, so like a kid that loves ketchup, it's so, and that they use like the fry is just the vessel, it's the utensil to get the ketchup to their mouth. Combining ketchup with, or whatever their favorite dipping sauce or puree is with the food that you're working on is an awesome way to do it. So like, let's say you're working on a carrot. They dip it into ketchup, and sometimes they're weird combinations, but they work. Dip it into ketchup, use it just as a spoon, but they're getting that texture of the carrot. They're getting a little taste of the carrot. It's kind of a fun exploration. You have to make it fun too. Fun exploration. And there's no pressure to take a bite of the carrot, but you can say, whoa, you tried something new. How fun was that to try a carrot as a spoon? Like it can be anything, a pretzel stick and a banana, but any sort of that combination. And this is where it gets really specific to your child. And I love doing that.
Okay, and Rosemary asks, any tips for kiddos that are nonverbal and still working on receptive language in relation to trying new foods? What I'm currently doing is placing her non-preferred food in her mouth and counting to 10, and then she spits it out.
I think if that's working and it's not aversive, like if she knows that she has that out to spit it out, then that's great. But really, like, the language piece isn't necessary for combining foods in ways. So if you make a list of kind of her favorite foods and then foods that you might want to work towards, how can you combine those? You don't really need, like, you have a nonverbal way for her to communicate that she's okay to spit it out. Sometimes we'll use like a no thank you bowl or a plate where is like the discard plate where we allow kids to take food out and say like, nope, that's not happening today. So you can do that non-verbally and just kind of demonstrate that is available for that purpose. But really just kind of the pairing non-preferred with preferred foods. Again, as long as there's no signs that it's aversive and that you're losing trust or that mealtime is becoming not enjoyable.
Right, it can't be traumatizing.
Right.
And we've seen that we've all seen it, whether we've been a part of it or not. We've seen something that's traumatizing at the dinner table where somebody is forced to put something in their mouth and then it turns into something else and it's a whole, it's a whole Jerry Springer show, right? And I think most people remember a moment where somebody forced them to eat something when they were a kid. We didn't like it. So just make sure that it's not something that's traumatizing. Okay, there was something else that I was going to ask you about and I completely forgot because I lost my train of thought there. But we're out of time anyway. But Dr. Yev, this is amazing. Oh, I know what I was going to ask you. it says here that you guys have been manualizing, and I had to look at that 3 times to go, what does it mean to manualize? So, but I think that means that you've been putting it together in a book form, yes?
It does, yes. So we're working on this first one is specifically for early childhood settings, and we're a ways out, but our goal is to make this information accessible and easy. So it's a work in progress. We're on the way to it. So I'll communicate that with you, Shannon, once
Yes.
we're a little closer and have some more information.
Wonderful. And by the way, Rosemary loves the idea of the no thank you bowl.
I love that too. I got that from my OT friends.
That's a wonderful thing. Well, we thank you, and we're saying hello to everybody at the University of Washington, where your students are, and how lucky are they to have you as a teacher and as the interim director of applied behavior analysis. And sometime you have to come back and talk to us about the work that you're doing for the Coalition for the Reform of Applied Behavior Analysis, because that's
I'd love that.
A big interest to me. I don't think I would ever have thought about that in those terms, except that now I'm seeing how, for me, what's crazy is how different everybody is doing everything. And while we want people to do things differently because every individual is different, I mean, like, totally not paying attention to the science different, which makes me itchy and crabby. Which we've had that conversation in the car.
We have, yeah. I'd love to talk about it.
We'll have to have you back on to talk about that. But please say hello to everybody up there for us, and thank you so much for being here with us today to talk about this important topic. I think everybody really enjoyed it. And expect some emails from people.
Thanks for having me.
All right, you take care.
I will.
Bye-bye.
You too.
Wonderful to have her here with us, answering you guys' questions and talking about this from a perspective that isn't hurt as much, which is that this does not have to be a battle at dinner time. All right, we are out of time, but we are back tomorrow with Let's Talk Autism with Shannon and Nancy. Nancy Alspaugh-Jackson will be joining me, and we've got some really important news stories to share with you. We have got a total of 3 guests who are going to be joining us tomorrow. Karen Hale is going to be joining us, and she is a mom and a pony. I don't know how she identifies, but she's a pony, and she is going to be talking with us about some of the things that she's doing on her radio show that you guys will find really interesting. And then we've got a mom and a son who are going to be with us. The son is one of the actors featured in the new Woody Harrelson movie, which one of these days I'm going to remember what the name of that movie is. But you guys have seen the trailer, and is it Champions? I don't know, Traven, if you can tell me. But we've seen the trailers. It's coming out in just a few days. I think it comes out on March 10th. And Woody Harrelson is a professional basketball coach who is tasked with going and coaching a basketball team that consists of all individuals who are designated as special needs. And the actors who played what is the name of it? Champions. Okay, so I'm not crazy. And they are champions. And we get to, I'm sure that we get to see Woody Harrelson's look at what this is and what this coaching opportunity is in a different way. So one of the actors from the team is going to be joining us this afternoon, tomorrow. We're going to tape it this afternoon to be live tomorrow with his mom to talk about what it's like when you get called up to be in a feature film starring Woody Harrelson. And this moment before everybody knows his name, we're going to have an opportunity to talk with this young actor. So you are not going to want to miss that hour tomorrow. And even though we're taping it this afternoon, I will be watching it with you live tomorrow. So any questions that you have, you can ask those in real time tomorrow, and I'll be answering. All right? We'll be back then. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and on Instagram for important updates. And please download our free podcast wherever you get your podcasts. Thank you so much. See you next time.